Have you ever been told that you have PCOS or even wondered if you might have it? Well, as of 2026, PCOS has a new name, and it's going to change the way that we think about this condition. It's no longer called Polycystic Ovarian Syndrome. The new name is Polyendocrine Metabolic Ovarian Syndrome, or PMOS. So you might ask, well, Dr. Jones, what is PMOS? Well, it's just an updated term. So instead of PCOS, think about PMOS. And the importance of that is the M. Global endocrine and women's health experts came together and agreed that polycystic ovarian syndrome was misleading because a lot of people who have this condition, they don't have the ovarian cyst, right? And then the biggest long-term risk are actually hormonal and metabolic, like insulin resistance, diabetes, and heart disease. And these are not just ovarian changes. So the new name, polyendocrine metabolic ovarian syndrome, is going to highlight three key things. Polyendocrine means that multiple hormone systems are involved, and it's not just the ovaries. So when you think about metabolic, that M in PMOS is strongly linked to insulin resistance, weight changes, and cardiometabolic risk. The ovarian syndrome part means that the ovaries are still part of the picture, but they're just not the whole story anymore. And you say, well, why would they go through all this trouble? Like, why is everybody just talking about a name change? It's not a branding exercise. This change came out of years of international work, patient surveys, and consensus meetings. And then one large global survey, a lot of health professionals also supported changing the name to better reflect a whole body impact. And when you think about health and wellness, you want to think about the whole body impact. And the reason why it matters is that because it helps with understanding. When we say PMOS, it reminds everyone that this is a multi-system endocrine and metabolic condition. It's not just, a few cysts on an ultrasound or an irregular period. And it also helps with earlier prevention because metabolic is in the name. It signals that we must screen for things like insulin resistance, type 2 diabetes, cholesterol issues, and blood pressure from the start. New name validates that fatigue, hair changes, skin changes, mood, and metabolic health are all a part of the same condition, PMOS. And for clinicians like me, the name PMOS is a reminder to think beyond the ovaries, to really look at the hormones, metabolism, mental health, and long-term cardiovascular risks, not just a woman's menstrual cycle. So if you already have PCOS or PMOS, your diagnosis is still valid, right? It's just a name that's changing. The fact that your symptoms are real, still a fact, right? But over the next few years, you'll just start seeing PMOS show up in like clinic notes, guidelines, and then online resources as health systems are going to start updating, the language and the coding. And you could absolutely say, I have been diagnosed with PMOS, previously called PCOS. And I know you think it's just semantics, but it really does help even with the stigma. So just understand, if you've ever felt dismissed because your ultrasound looked fine, this name change is actually for you. So the name change shifts the focus from what your ovaries look like to a diagnosis that shows that your entire endocrine and metabolic system is actually doing something abnormal. So this is my call to action. If this resonates with you and you've been told that you have PCOS, which we're now calling PMOS, I want you to know that 1 in 8 women worldwide are affected. 1 in 8 women worldwide are affected with PMOS, and you deserve comprehensive evidence-based care that looks at your hormones, your metabolism, your heart health, your fertility goals, and your mental health all together in one picture. So make sure that you continue to follow me for more practical, science-based health topics. Drop PMOS in the comments if you want me to break down the testing, the nutrition, and the treatment options in future videos. Make sure you like this video and share it with someone who may need to hear it.